Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, Presidential Task Force briefing holds. Members insist a lot more needs to be done to win the COVID-19 war. On our theme this evening, we look at reviving the economy, battling the invisible enemy. And UK Prime Minister Boris Johnson leads COVID-19 brief, his first after recovering from the virus. And even though nations are struggling to contain the coronavirus pandemic, there appears to be new thinking about how the economy will be restarted, with a phased easing in the capital, Abuja, the commercial city, Lagos, Ogun State, and across other states. Currently, the Presidential Task Force, PTF, hinted at some guidelines that will allow the country return to work in phases later today. An economic expert joins us later on the program on the measures that should be in place for quick economic recovery. The NCDC reports that 307 patients have been discharged after testing negative to COVID-19, while the death toll is now 51, and the total confirmed cases in Nigeria stands at 1,728, following the announcement of 196 cases yesterday by the Nigeria Center for Disease Control. Let's take a look at the state-by-state breakdown, showing Lagos with 931 cases, Abuja 174, and the epicenter in the northern region, Kano, with 139 cases. Now, Kano State remains a major concern to the Presidential Task Force following reports of several unexplained deaths in the ancient city. Speaking today at its regular briefing, the Secretary to the Government of the Federation, Mr. Boss Mustafa, explains that the federal government is awaiting the full report on the Kano situation, but that a team of medical practitioners are on their way to support the efforts. He also warns that the decision of the federal government to ease restrictions should not be seen as an opportunity for citizens to act without care.
No one of restrictions for permission to act without care. The security agents have been instructed to respect the rights of citizens while also ensuring strict enforcement. As you know, our national response is driven by strong collaboration with subnational levels of government. In this regard, I'm glad to mention that Lagos State has already adopted these implementation guidelines, while other states are also expected to follow suit shortly. I wish to use the opportunity to reassure Nigerians resident in Kano that the federal government, and particularly the Presidential Task Force, is with them and shall do all possible to fight the spread in the state as directed by the President. Kano is one of our historical cities and remains a backbone for the economy of this nation.
It's about the mental health strategy for...
The Minister of Health, Dr. Osage Haniwe, confirms that the team from Irua and Lagos are already moving to Kano for additional support. And during the question and answer session, he said the recovery rate for the coronavirus victim is 95% and that less than 5% are critical cases. He reacted to the report from the Nigerian Resident Doctors Association that over 350 doctors have been infected. He says it is untrue and that it is only 113 health workers.
As for the doctors, over 300 doctors, that's a fable. That is not true. There are not so many people in the health sector who are infected. The latest figures we have is that there are about 113 actually, and these 113 are not all public health workers. There are some, for a good number, from private hospitals. And if you hear us speaking here frequently against trying to treat coronavirus in private clinics, we're actually referring to people who do so without having necessary precautions, without having necessary training, because they risk infecting themselves and they go home and give this infection to their family, and that is not the right thing. So the healthcare workers who have no training, have no business actually handling coronavirus. As for those who do not have equipment, we have said that we've provided equipment for and PPE for all those who are out there. There are one or two places where we have heard that there's a tightness in supplies, and I've tried to send them over there. But let me remind you again that there's a global shortage of health PPEs. There's a global shortage. Many countries are struggling and hustling for PPEs, even for the gowns, for masks.
Again, for coming for another press briefing. And like I've said severally, we're doing their very best to come up.
On his part, the Director General of the Nigeria Center for Disease Control, Dr. Chikwe Hekwazu, raised concerns that Lagos is struggling with bed spaces and that the Commission is re-strategizing to adapt to the realities of the moment.
There's no doubt about it. We are struggling in certain places, especially Lagos. To an extent, Kano and Abuja too, but the biggest challenge right now is in Lagos, where bed spaces are really tight. Across the country, we have about 3,500 bed spaces identified as available for COVID-19, but in Lagos, we're already struggling. And so we're going to work with them to keep trying to make more spaces available, but ultimately, we might have to change our strategy a little bit and start considering home care in certain circumstances where firstly, you're able to provide a room where a patient can be managed sufficiently, or secondly, we're able to support the care by enabling healthcare workers come to that. But we will always be honest with Nigerians. We are struggling at the moment. We might have to adapt our strategy because of the realities we face over the next few days and weeks. And as we do that, we'll make that clear to Nigerians. Our policy hasn't changed, but the pressure is there, and that might have to change in the next few days.
Now, on the issue of the number of doctors or health workers infected, earlier today, I spoke with the president of the Nigeria Association of Resident Doctors, Mr. Liu Sokumba, who said that the doctors need more diagnostic tools and that over 350 medical doctors across the country are in isolation after being exposed to COVID-19. He said 29 of them have tested positive, while 5 doctors have died.
Well, as we had continued to advocate that because of the inadequacy of personal protective equipment across the hospitals in this country, our health workers have continued to be exposed to this deadly disease. As we speak, at the moment, we have 29 doctors who have been tested, who have been confirmed to be COVID-19 positive, while over 377 have been quarantined, having been exposed to a confirmed case of COVID-19. This has continued to corroborate our earlier claim that the healthcare workers across the various hospitals in Nigeria are not adequately protected. And as a result, we have continued to experience more and more healthcare workers, especially doctors, testing positive to this disease. As we speak, again, we have 5 doctors who have died from this COVID-19, cutting across various regions in this country: Lagos, Katsina, Uyo, and Umuahia, and so on. So the point we're trying to make here is that we have continued to advocate and clamor that our health workers are not adequately protected. And this is already manifesting in the reality that these people are coming down with the disease, and some are already dying from the disease.
Of course, the Minister of Health today at the PTF briefing said the figure is just 113 health workers. Moving on, Yobe State Committee on COVID-19 Prevention and Control has confirmed 1 index case of the virus in the state. Addressing journalists today, the state's deputy governor was also chairman of the COVID-19 committee, Mr. Idi Bade, says the patient is a 29-year-old man with no travel history. He also adds that 3 samples of the suspected cases were received and sent to Maiduguri, Borno State, and 1 returned positive. But let's go over to how indeed we can manage to slow down the rate of infection. Joining us from the United Kingdom is Dr. Etienne Ukorobi. He's a GP registrar with the NHS. Thank you for joining us at this time.
Thank you very much, Millicent.
All right. Dr. Ukorobi, tell us about the gains in the healthcare system there in the United Kingdom, especially with battling COVID-19. The Prime Minister is back again at the helm of affairs, and he was briefing today saying that England is past its peak.
Yes, very good to announce today. The Prime Minister said for the first time that the United Kingdom has now passed its peak, and the curve for the coronavirus has started to decline, which is a major gain for the health sector in the United Kingdom. Also, we can see in the last couple of days that the number of hospital infections hospital admissions, I beg your pardon, have reduced significantly. Also, the number of new infections have also reduced in the United Kingdom. And that's a plus for the system. And that goes a long way to show that the two systems that were outlined by the UK government, which is the capacity boosting and the social distancing technique, has actually worked. And yes, we've seen quite a lot of people die in the United Kingdom, more than 26,000 people. But there is some light at the end of the tunnel as we approach the coming days.
Here in Nigeria, after the briefing, the Committee on COVID-19, there's been talk about limited bed spaces, especially in Lagos with its numbers. But then, of course, more work is being done to ramp up testing across. But what's your take on perhaps how we're doing, especially to stopping the stigma? We still hear a number of people who go into hiding as soon as they're told they're positive.
Right. Nigeria has got a very large population, and it's important that Nigerians get tested. It's important that we know those who are positive for coronavirus, just like we have done here in the United Kingdom. So we have ramped up testings to include the vulnerable groups, the healthcare workers and their families, the carers and the residents in the care homes. So a large number of people are being tested, and we have been able to see the trend of the virus from this large scale of testing. That's the same thing that we expect in Nigeria, even though I know there is a global challenge as regarding testing kits and things like that. But Nigerians need to be aware that if people are not tested, then we might see this virus spread, as we are seeing at the moment in Nigeria, very quickly, and we don't have the health facility to contain this virus should it spread massively. So one of the things that the social distancing does, and which it has done for the United Kingdom, is that it has slowed the amount of hospital admissions at every particular time. So social distances reduces the number of people you have admitted into hospital, as well as the number of people you have on ventilators and the number of people you have in the intensive care units. If we are not testing in Nigeria, we might get to a situation where lots of people have become infected and lots of people need hospital admissions, and it will be a major hit to the health sector. It will be a major hit to the intensive care sector in the Nigerian health system. And I think they might not just be prepared for that and be able to contain that. So I think it's better for the NCDC to ramp up the testing, to ramp up the tracing, and also the treatments of those that have been infected at the moment.
But finally, how do you think we can reach the unbelievers of this virus existence?
Well, there is a lot of proof to show that coronavirus is real. We've seen more and more survivors come on air to speak about their symptoms. I personally have treated patients that have had coronavirus. I have seen patients that have died from coronavirus. In the UK particularly, you would realize that about 80-something healthcare workers have died from coronavirus, and 60% of that number have been from the Black, the Asian, and other minority ethnicity. So it tells us that Nigerians are not exempted from the virus. It tells us that Blacks are not exempted from the virus. As a matter of fact, the Royal College of Surgeons today moved the motion that Black and Asian doctors, as well as other minorities, should be removed from the hotspots where we have these patients with coronavirus, because it looks like Blacks are more susceptible. So Nigerians should be aware, those who still don't believe, those who still think that it is a scam by the government, that people are dying. We have 26,000 people in the United Kingdom that have died from coronavirus. Over 50,000 people in the United States have died from coronavirus, and over 200,000 people globally have died from coronavirus. That statistics alone should help Nigerians to stay at home. Finally, before I end, I also understand that the government is planning to ease the lockdown. In my opinion, I would say that this has come rather, earlier than expected. There are modalities that I believe the government should follow before considering easing the lockdown.
I wish we had more time. We're told to expect a few of those modalities later today. But thank you, Dr. Esther Ukorobi, GP Registrar, NHS England. Thank you for joining us on the program.
Thank you very much.
So to come on our COVID-19 update, what does a post-pandemic economy look like? We have a guest who joins us later on that. Welcome back. The federal government continues to collaborate with states as it moves to reopen the economy after weeks of lockdown as one of the measures put in place to curbing the threat of COVID-19. According to the chairman of the Presidential Task Force on COVID-19, the reopening process will be in phases spanning a total of 6 weeks, broken into 3 tranches of 2 weeks each. The same gradual approach is being adopted in Lagos as the governor, Babajide Sanwo-Olu, also released guidelines to include commercial motorcycle operation across the state remains suspended, tricycles limited to carrying only 2 passengers, commercial buses allowing to load 60% capacity with all air conditioners off, all commuters must wear masks and gloves. Banks and other companies are allowed to work between 9 a.m. and 3 p.m. with only a maximum of 60% capacity on ground, while other staff are to work from home. Places of worship, as well as beaches, clubs, gyms, salons, cinemas, swimming pool remain closed until further notice. Schools also remain closed, but are advised to use their digital space to teach and engage students. Markets are to open on designated days between 9 a.m. and 3 p.m., while eateries, restaurants are to open between the same time with only take-away services. Lagos, Ogun, and the Federal Capital Territory have been on lockdown in the last 4 weeks. Joining us for more on restarting the economy in phases is an economist, Professor Mike Ikopolati. He joins us from our Abuja studios. Thank you for joining us on the program.
Thank you very much. It's my pleasure being here with you.
All right. Now, health researchers are saying that managing the virus will be a long-term gain or game, so to speak. That means COVID-19 will impact the economy for months and even possibly years. So how do we go about restarting the economy?
Well, the post-COVID-19 era in Nigeria is going to be a very difficult economic situation. Currently, the IMF has said that there's likely going to be a reduction in the global economic growth by about 3% this year. And Nigeria is even likely to be more affected. There are a lot of, because of the lockdown due to COVID-19, there are a lot of sectors that are being paralyzed, especially the travel and tourism sector, the manufacturing industry, and some other vital sector of the economy are being paralyzed. And so what will likely happen at the end or in the long run is that the Nigerian economy is going to be facing a difficult time. And government needs to look at it and take a holistic approach and begin to think and look beyond the actual health situation that we have in Nigeria now.
So indeed, what are the measures or steps that government can begin to take? And this is looking at the federal government on one hand and then the states as well on the other hand, especially to restore investor confidence to getting the economies working. Professor? All right, for some reason, we seem to have lost our guest there. We'll probably try and get a hold of him a little later on. But we hear that 42 samples of Almajiri returnees from Kano State to Bauchi have been collected for COVID-19 testing. Also, 7 doctors have gone into self-isolation after coming in contact with a COVID-19 patient. The governor in the state there during the inaugural expanded weekly briefing on COVID-19 gave those updates. But here's our correspondent, Hajira Aliyu, with more.
There's no end in sight, at least for now, to the global pandemic because the number of cases keep rising. When you come to schools like this, what you get is an eerie silence, or sometimes children from the neighborhood that have come to play. Schools have not seen activities for weeks. Children and students and parents have been forced to stay at home. Most of the classroom doors are shut. We've seen response plans by the state governments in collaboration with UNICEF and some broadcast media organizations. Yesterday, a learning radio and television program was launched, and this is meant to target 1.7 million pupils at home, especially those in the rural areas. Community radios, of course, are expected to broadcast some of these programs. To speak about this is Comrade Jafar, who is a lecturer and a parent. Comrade, what are some of the setbacks caused by the pandemic on the education sector?
Well, without mentioning what's the multiplier effect or consequences of this pandemic on the educational system cannot be overemphasized. Because you know that the pupils at the primary school level, most of them are just about doing their second term examinations. Those in the secondary school, some have already written their JAM in anticipation of gaining admission into tertiary institutions while awaiting, the WAEC and NECO, which also are prerequisite for gaining admission into the tertiary institution. At the tertiary level, ASU is on strike, yes, but the polytechnics and colleges of education are in session, but the circular from the Federal Ministry of Education put on hold virtually all educational activities. Nobody can rightfully say, the impact, the severity of the impact on the educational system.
Okay. Thank you very much, Comrade. There's no doubt that one of the hardest hit sector is the education sector. That's the update we have for now from Bauchi State. I'm Hajira Aliyu, Channels Television.
Thank you, Hajira. Here we have Professor Ikupolati back on right now. Professor, welcome back. Just quickly to ask you how indeed we can restore investor confidence and make the best of perhaps a bad situation.
Yes, I was saying that getting the economy on track again will require a lot of collaborative effort between the federal government and the sub-national government in Nigeria. And also, the private sector will also have to cooperate with the government to ensure that there is an improvement in the economic situation after the COVID-19 era. One of the major sectors that will be affected is the manufacturing sector. And I will expect that government should come out with a robust economic reform that will give a lot of palliative to the manufacturing sector to enable them to come back to form. Support such as extending credit line to the manufacturing and the SMEs in Nigeria, reducing infrastructural costs to the manufacturing sector, provide the short-term funding to them, and providing supply chain support to most of the manufacturing industry. These are some of the things that will make the manufacturing industry to come up again after COVID-19. Again, government will also need to use a lot of diplomatic approach to handling relationship that will enable everyone to cooperate with government after this COVID-19. You see, economic rejuvenation requires that government packages are believed by the people. There is the need for people to trust government policy on bringing back the economic to form. And that will require diplomatic approach to managing relationship between the federal and the state government, and also between the public and private sector in Nigeria. So a lot of systemic intervention will be required on the part of the government to bring the economy to form. If you look at it, government must also not depend on too much on external support, because most of the places where government can turn to are also currently facing the same situation, such as America, UK, and some other
Professor, we'll definitely have to bring you back as we ease into, opening up to businesses. We'd like to thank you. Wish we could get more of your insights, but we appreciate your time. Professor Mike Ikupolati, President, Chartered Institute of Public Diplomacy and Management. Thank you for joining us.
Thank you very much. It's my pleasure.
Right, and the UK Prime Minister Boris Johnson has chaired his first cabinet meeting and delivered his first press conference since recovering from COVID-19. He apologized for being away for so long and says he is not going to delegitimize the challenges facing getting PPE for healthcare workers or the frustrations experienced in expanding numbers of tests. But he says his message to the public is your efforts, your sacrifice is working and has been proved to work. From the NCDC, our Muslim brothers and sisters taking part in Ramadan must observe all prayers and meals within their homes, as no gatherings are allowed. The center continues to work closely with states. You can find the latest national strategy to scale up access to testing. That's our COVID-19 update at this time. Another update comes your way again at 9 p.m. I'm Minister Tumwoka. Stay safe.